Great. So we're ready to go.
Excellent. Well, welcome everyone, and thank you for joining us this evening for FuturePedsRes International Medical Graduate Webinar for the 2023 match cycle. We are so excited to have everyone here, and we have a lot of excellent questions already, so we're very excited, and I think this will be a very fruitful discussion tonight. As you can see on the screen right now, there is a link and a QR code to a survey that's going to help us get your perspective on what you're hoping for out of these events, what you'd like to see in the future. So we would really appreciate, it should be pretty quick, we'd really appreciate it if you complete it. And with that, we will start tonight's event. So my name is Amy Lorber, my pronouns are she, her, and I am currently a fourth-year medical student at Western Michigan University School of Medicine in Kalamazoo, Michigan. And I am serving as one of the co-directors of FuturePedsRes this year. Chiamaka, you're muted.
Oh, I'm so sorry. Hi, everyone. My name is Chiamaka Nwachukwu. I am an international medical graduate from University of Lagos in Nigeria, and I'm currently a junior clinical fellow at King's College Hospital in London. I also serve as one of the co-directors for FuturePedsRes. As always, we would like to highlight our founders here at FuturePedsRes, who are now second-year pediatric interns, Michaela and Nick. They have been instrumental in making sure that this happens, and we are grateful to them for their guidance and leadership. We would also like to acknowledge Dr. John Frona, Vice Chair of Education and APPD Recruitment Action Team member, as well as Colin Hughes, Associate Executive Director, respectively, with the APPD, who have helped make these webinars a reality. We're also grateful for the leadership of Dr. Pat Poitvian, as well as Dr. April Buchanan, President of APPD and COMCEP, respectively. We're excited to have you here with us. Yay, and hope that some of the information that you get today will leave you with some gems of information for the upcoming PEDSMAT 2023 season, especially if you're an IMG like me.
Excellent. And with that, it's now our pleasure to introduce you all to our Assistant Director of Equity for International Medical Graduate Applicants, Carolina Largo.
Hi, thank you, Amy, for that wonderful intro. Thank you, Shamika. And thank you all again for tuning in tonight. It has been an amazing and crazy time planning this webinar. And I would like to thank the entire FPR team, especially the webinars, the equity, and the publicity team for working so hard to make this happen. So now let's delve into our objectives. So the IMG mentoring session goals for this night is to provide IMG resident applicants with tools toward empowering ourselves, because myself, I'm also an IMG, and to show ourselves how strong applicants are we for the March 2023 residency cycle. We also want to provide you with advices on finding mentors and sponsors to help navigate to the virtual session. And we would like to give you some recommendations on how to avoid major pitfalls. So during this night, our event will be a panelist discussion, and we will proceed with a prepared question and answer, followed by opening the floor to any remaining questions that you may have. We will be joined by all of our webinar attendees here on Zoom, as well as actively engaging via Met Twitter and live tweets throughout tonight's session. Tell your friends and colleagues to log on if they haven't already done so. And you can use a hashtag FPR webinar to make sure we see your tweets. If you have any question here in Zoom, feel free to drop on the chat for everyone to see, or you can also send us a message by the chat that is here. Now I'm gonna introduce our panelists. This is the moment that all of you are waiting for. And on behalf of FuturePedsRes, I would like to give a warm welcome to our esteemed panelists for tonight. First, we have Dr. Renuka Mita. Her pronouns are she and her. She completed her medical school at Rajendra Medical School in Ranchi, India, and trained in the US at the University of Kentucky for residency, followed by completion of her fellowship training in pediatric critical care at the Medical College of Georgia. There, she now serves as Associate Program Director, teaches multiple courses, and has won several teaching awards. Thank you, Dr. Amita, for being here.
Thank you. And I'm excited to be part of this webinar.
Now we have Dr. Lewis Crota. His pronouns are he and him. He is the director of pediatric residency program, and he is the chief of the section pediatric rheumatology at the Brooklyn Hospital Center. He attended the medical school at Tufts University School of Medicine, and he completed his pediatric residency, chief residency, and pediatric rheumatology fellowship at Mount Sinai Hospital in New York City. He has been at the Brooklyn Hospital Center for over 10 years, where he is a program director for over 5 years now. Thank you, Dr. Lewis, for being here too.
Thanks. It's a pleasure to be back here.
Now I want to introduce you to Dr. Jocelyn Salvador-Sison. Her pronouns are she and her. She currently is a pediatric intensivist at the Bronx Care Health System in the South Bronx, and she is the Associate Program Director for the Pediatric Residency Program, as well as the Director of the Pediatric Residency Quality Improvement Program. She's a native of the Philippines, and she graduated from the University of Philippines College of Medicine before moving to New York City. She completed her pediatric residency at the Bronx Lebanon Hospital Center and her fellowship in pediatric critical care medicine at the New York Presbyterian Hospital Weill Cornell Medical Center.
Hi, good evening, everyone. Thanks for having me, and it's good to be back.
And I want to introduce to Dr. Suzanne Wright. She serves as the director of Marshall Clinic's Pediatric Residency Program and as a clinical assistant professor of clinical pediatrics at the University of Wisconsin School of Medicine and Public Health in Madison, Wisconsin. She attended the medical school at Baylor College of Medicine and completed her pediatric residency training at the University of Utah. Okay, now I want to thank you all for being here tonight. And without further ado, let's get started with our frequently asked questions portion of tonight's webinar. I'm going to address the questions that we have to our panelists. These 4 questions I would like to address to Dr. Lewis Crota. What aspects of the ERES application are weighted more by program directors for an IMG?
I'm unmuted now. I think one of the first things that it depends on the program, obviously. A lot of programs do have a graduation year cutoff. So I think it's important that you do look at the websites and make sure that you see what they use as their graduation year cutoff. Some will do 2 years, some do 5 years, some may have no limits. If you're not within their limits, then again, it's going to be a waste of your time most likely. So the first thing you should do again is probably the first thing that we would look at is that. After that, we're most likely going to look at your scores. We do get a lot of applications, or I get a lot of applications, so I do look at the board scores. And step 2, CK, is probably going to be the most important thing this year, because step 1 really went to pass fail, and it's going to be impossible for me to compare a 198 with a pass fail, because it could be a 240, it could be a just pass. There's no way for me to tell anything about it. Beyond that, then we're going to look at your MSPE and your personal statement. And I do think your personal statement has a lot of weight, especially for the international grads. This is our opportunity to see how well you communicate. It's an example for us to understand you better in terms of what you want out of coming to train with us. And I think that it's critically important, because I have seen personal statements where people have not had proofread. And I think it's really, a shame for a resident, even English-speaking residents, or as their first language, make a lot of mistakes. It's harder, I think, unfortunately, for the international grads, and you really do need to make sure that somebody proofreads your personal statement as well.
Okay, thank you so much. To all of our panelists, if you want to say something else about the questions, you are more than welcome to. Now we're gonna go ahead with our second question. I'm gonna address this question to Dr. Salvador Cizon. Does a step 3 matter, and if it is required before the application deadline?
So step 3 is required just in general to complete your residency and be able to sit for the boards. In terms of applications for residency, it is essential if you are intending to get on an H-1B visa. If you are planning to be open to a J-1 visa, you are not necessarily required to take your step 3 in order to be able to apply and match. That being said, in general, it is must be very advisable for an applicant to have step 3 kind of done before you start residency. It allows for residents to focus more on pediatric training. Some of this requirement for applications into residency programs may be program dependent. So there are going to be some programs that will, request for some applicants to, please provide us with your step 3 results. That may impact their application depending on what the program's needs and requirements are. To have it done before the application deadline is not necessary as opposed to advisable, or it's always better. But let's say that you have your step 3, and we understand, a lot of programs understand, particularly for IMGs, the limitation of having to come into the US and get the step 3, that for many reasons, it would be advisable to do it along with, let's say, if you were to come to do, in the past, if you were to come to do personal interviews, then we would understand that it would be done before. With COVID, we understand that there's a lot of limitations, particularly in international testing sites, or in international travel, to be able to come in and get some step 3 done. And so taking the step 3 during the application period and having the result, let's say, before the match, will impact a lot of the applications that we've had over the past 2 or 3 years. If you are to take your step 3 after the application period, and even after you've done your interviews, it's always advisable for you to provide your results to the programs that you've applied to, even after you've interviewed with them. So this way, your profiles are updated, and your kind of application is all that more complete, and then you get credit for that.
Thank you so much. Excuse me. Now we have our third question. I want to address this question to Dr. Mehta. As an IMG, how can we best market ourselves?
So that's a great question. And, I'm looking, I've been doing these interviews for past almost 15, 16 years. And as you already been alluded to a couple of things, the first thing is, you need to get an interview, and you already got it, that your personal statement, has to be, your step scores are important, and your and how long you've been out of your residency or training, that's important. But the personal statement, that's what the first you need to hone onto it. And I would say it shouldn't be like 2 pages personal statement, but it should be like your first paragraph and your last paragraph should be what you are. That will really help, because people do read personal statement to start with. And then how can you make that personal statement the best, and how it looks like? So as soon as people see it, say the yes. So come up with the positive, whatever you think that it shines upon you. It could be, I worked in this place and I've seen so many of these patients, and I'm good at this, so showing your, try to shine up whatever you positive you have, because people already know that what's your scoring is, how much you're out of it, but whatever positive you have. So that starts with your, personal statement, because people are going to look at it before you get the interview. And then with having with the interview, obviously you have to dress up appropriately, communication, try your best. Some of international medical graduates may not have the best English because you are from different part of the world, but that's okay. People are not looking for, but dressing up, when you're having interview, it's a good lighted room, those are things are going to be very, very helpful. And then again, as I mentioned, that bringing up what can you bring to the program, which could be, related to your well-being or related to your curriculum, related to your, changing, or, specifically interested in cardiology. How can I bring that? How can I, change your morning report or noon, something related to, I think that makes you worthwhile, that this diverse candidate can bring very positive changes to our program. So these are some of the things, we can keep on going, but and then try to highlight in your resume whatever positive things you have done, including, I know people do volunteer work, but anything specific and special you have done, those are going to be very, very helpful. But make sure you have everything, put it in your resume, even if it's the tiny things, it does matter. You can divide into, different categories, but you make sure that, this is the way you have. Try to work on the resume, which is, which every, local graduates are putting it in the way, so that, you have everything there and not, so try to get in touch with the people and try to find out what is the best way to put a resume so that you're not missing anything on it. If you have worked in this country, get the reference. That is very, very helpful. And I'm sure you guys know about all those things, but letter of reference from working with any faculty is going to be very, very helpful, because that's what people are going to look for it. So I can keep on going, but I'm sure some of you guys, other people will have also some tips as well. So.
Yeah, I think so. Dr. Lewis Crowder, I think he wants to say something else.
Yeah, I wanted to add, I guess, when I think of marketing, I also think of the pre-interview and the pre-application. And I have to say that I know that I get inundated with emails from applicants all the time. I think you have to sort of realize that sending an email every day to somebody becomes an annoyance after a while. And that when you become an annoyance, you get put on a bad list. The other thing you always have to remember is the coordinator is our gatekeeper. And when you call our coordinators all the time, and if you really bother the coordinators, they're going to tell us this applicant is just too annoying, we can't have them. So it's very difficult, I think, to have that balance of getting yourself known, because I do think that a lot of the international graduates especially want to sort of get themselves known. And I think it's perfectly fine to send an email, if you don't hear back, to send another email. But if you're going to call every day and you're going to send an email every day, it puts you sort of in a bad light. And that, I think, again, is the other marketing of what people end up doing. So you have to sort of look at that balance of, trying to get yourself in there, but not be overly an annoyance, for lack of a better term.
Thank you so much, Dr. Lewis, Dr. Mita, and Dr. Salvador, for your advices on this session. I have one more question.
Can I just interrupt?
Of course.
Also, Dr. Lab, he mentioned that don't bother, but be good to program coordinator. One negative thing is not bothering, but if you're calling them, they are, if they can put you in the right place. So really, really be good to them. They are, you don't think that they are just the, clerks or secretaries. They are the meat of helping to get things put together. So they are very, very valuable team members for recruitment. So be really good to them. So I think a lot of time as an international medical graduate, we forget about it. So.
And I wanted to mention, I'm sorry, Dr. Largo, I also wanted to just mention something that Dr. Krata had actually said in some past sessions that we've had in the past years. If you have a gap in your training, or there's some unusual things, or let's say there is some deficiencies in your application, it actually helps to put that in your personal statement, to kind of explain how your life course has led you through different things. What have you done? How you've overcome that? It really helps us when we're reading your portfolio and putting the pieces together to know, how you've gone through life and what were the things that, we may not be able to distinguish just based on looking at your CV. That really, really helps.
Thank you so much. This has been very, very interesting to know from the program directors, the associate program directors. I think this will help a lot to the IMGs to understand your perspective. We have our last question that probably is connected to we were discussing. Given then that IMG's graduation and application year may differ, what can they do to address this gap in their application? I will have this question to be answered for any of you if you want to go for it.
I mean, I think what Dr. Salvador was saying before, if there's, as well as deficiencies, but anything you've done. So if you graduated 5 years ago, you want to know what you were doing. If you were doing residency, if you were doing practice, if you were doing electives in the United States, what were you doing and what did you get out of it? And I think, again, it's important that we know all that. When you put together your CV, your CV should not have major gaps in time. It's hard when I look at this, 6 months is one thing, but when there's a year or two gap in your CV, I don't know what happened. Where were you? Why was there such a big gap in your career? Anything you're doing, if unfortunately you couldn't get a job and you had to support your family, well, that's admirable. And that's something that I want to know about as well. But, I want to know, did you do volunteer work? Did you do, something else? Were you being a scribe someplace? And were you doing electives here in the United States? Anything and everything you've done that we can fill in that time is going to be helpful for us.
I've seen applications where they're actually not just including their medical work in the work experience, but they'll put in their actual work. So there would be people who, let's say for financial reasons, had to work. I've seen some work as advertising consultants or clerks, or work in different other levels in retail or industry, and fill those gap years. And that helps us kind of think about what they're going through at that time. And then either during in the personal statement or during their interview, they actually then kind of describe the personal circumstances that they're in. We've had some really great residents come through where if given the opportunity to really explain what they've gone through, that they would be able to get into a residency and show that it was really more life circumstance as compared to like ability, because we'd like to provide opportunity to people when it's possible. So it's really important to have the applicant make it come through in the application, however limited that will be, that you're as an applicant in medicine, you are committed to continuing a medical education and training, and show your resilience. If you truly have circumstances that are beyond your control, it's really helpful to understand that.
Thank you so much. This has been really, really a super learning experience for all of us, I believe. Now we have the question and answers that we have the questions from Zoom and Twitter too. So now we are opening the floor for this type of questions. First, someone asks, there are many IMGs, cross or dual apply to a specialist like internal medicine as an alternative plan. Do you see that as a red flag, or what are the potential pitfalls applicants should be aware of?
I think in the world of virtual interviews, it's not as bad as when we had in-person interviews. There's never anything worse than when you see somebody you just interviewed for pediatrics taking a tour with the family medicine residency group or with the internal medicine residency group, because no matter what your first choice is, I'm always going to think that I'm your second choice. So, I mean, I think the virtual interviews have taken that aspect away. The downside is really that you have to put on your pediatric hat when you're talking to the pediatricians, and you have to put on your internal medicine hat when you're talking to the internal medicine people. You have to put on your surgery hat if you're talking to the surgery people. It is a little bit of a shift of thought process of the way that we think, the way that we see things from other different specialties. And sometimes it can be a little bit different. The other thing is to really always make sure that you don't cross your letters, don't cross your letters of recommendation. There's nothing worse, again, than when I get a nice application at the bottom, it says, this person will make a great internist. Or your personal statement says, I've always wanted to do surgery. When I see that, it's sort of, no matter what you want to do, I feel inside of me that this person doesn't really want to do pediatrics, and that's not what they're looking for primarily. So you've got to really be careful about those things. And it's, they do slip through the cracks, even though Eris looks for it, they do slip through the cracks. I can tell that I get it all the time.
Yeah, and I agree with that. It's, you are trying to, interviews are not easy, especially if you're in international IMG, you don't know where you're going to land up. So you do want to not take any chances. So, but you got to make sure that you go through your application and everything and be prepared for it, that can happen as well. So you got to be, careful. But you should be able to know where do you stand. If you have a great USMLE step 1 results, you're in 95th centile for, and your letter of references are great, your, SEP score, CS scores are great, your communication skills are great, then your chances that you will get into a residency program. So you don't have to stress yourself out with several of applying for all different programs, different specialty, not just programs. So that will be my suggestion. So
I do want to just, thanks. I do want to just put in that programs, especially like for all subspecialties or all specialties, we are looking for ideal candidates for our specialty. And if you're an applicant, again, like Dr. Mehta said, we understand your need to, want to make sure that your bases are covered and you get a program, particularly if you've already not matched in the past and want to match again. But I do encourage everyone to think about the next 3 years, right? So it's one thing to make sure that you are able to get into a program, but it's, your sincerity and your desire to actually get into a pediatric program will impact your next 3 years. And so if you're spreading yourself too thin, particularly including specialties that may not be your cup of tea, it might not be a good 3 years for you. Sometimes that does come through on the interviews, but what I personally get sad about is, let's say that we do take them and we realize that that person really wasn't so much into pediatrics. It kind of is difficult for us to get that person through residency, knowing that, their heart might not be into it. It's very rare that that happens. But when it does happen, we kind of, think it's always great for someone who actually comes and matches for themselves to be dedicated to the specialty that they want to get into.
Thank you. And
I just want to also tell that this doesn't happen to IMGs. This happened to local graduates as well. And we have several of these, students did not match this year because they were, they did not take, they applied for different programs. So this can happen to anybody. So IMGs, don't take it that, so you got to be careful when you're applying for, several different specialty, because you're not sure what you're doing it, because it's going to show up somewhere in your during your interview, so it happens to everybody. So you guys are not the only people this is going to happen. So
thank you. And following on this matter, do you think is there a way dual applications affects the way the NRMP algorithm matches applicant? Like how the algorithm works, it will affect at the end to the applicants?
No, it doesn't. It's how you enter your match list. There's a great YouTube video that you could just Google NRMP algorithm. It's about a 10-minute video, and it explains the whole way that the NRMP algorithm works. We don't know anything about, unless something slips, we don't really know who else you've applied to. We can't ask, by the rules of the match, we can't ask about other programs you've applied to either. So if you don't say to me, oh, I applied to internal medicine at your hospital, I'll never know. If you slip up, then that's, again, the only way we'll find out. But there's a great YouTube video, and it's maybe 10 minutes. It explains everything about how the algorithm works.
Thank you so much, Dr. Lewis. Now we have another question regarding the clinical experience. How do you think this has changed since COVID? Obviously, IMGs need to get US experience to go into this residency application season. So do you think COVID changed something?
I mean, I think COVID changed everything. There's nothing that COVID didn't touch. I think the whole virtual interview season is primarily created because of COVID. I think the positives of it is that it does open up interviews to a lot of people who could not afford to travel, either within the United States or into the United States. So I think that the positives of COVID are the fact that the interview process has really opened up to a lot of people that may not have been able to apply to a number of different programs. I think the expectation that applicants necessarily have to have US experience, again, is not, I don't think it was it's nice to see it, but I don't think it's as critical, because a lot of what the IMGs did was really just observerships. They didn't really do very much besides, no hands-on. They rounded with teams, and that's great. It's a great experience. It's great to see how they, the system works here, but it's not like they really had that much hands-on experience. I think unfortunately, even our residents couldn't do electives at other hospitals because of COVID. So, I think people don't expect that within the past 2 years or 3 years that people have really done a lot of, had a lot of clinical experience necessarily here in the United States either.
I'll probably echo that. We have seen much less kind of notations about US clinical experience. Like most of the time, yes, it was observerships. Over the past 2 years, it has not been something that we would highlight to say that residency applicants did not have US experience. There has been an interesting change though. We've had some applicants have telemedicine experience. They would do observerships, or they would do telehealth. They would have, there were some that were doing some screenings of, especially in 2020, they were screening some patients on a remote basis for some institutions, which was interesting. So COVID definitely seems to have limited the in-person US clinical experience, but it seems to have opened up a little niche telemedicine and telehealth opportunities for observership for some.
So I don't think this year recruitment was any different than year before. I can give example of my institution, even with the COVID. So So there are some positive, some negative. So it balances out. So I don't think the outcomes had been much different just because the COVID hit 2 years back. This is my observation. So we have recruited a couple of international medical graduates so this year as well, and that's what is our standard. So it did not make any difference. So.
Perfect. And now regarding program signaling with the supplemental application, how important is that a factor while choosing applicants for interviews?
I think this is the first year that we're going to have a supplemental application. I'm not sure that anybody really knows how important it is or how unimportant it is. That's sort of like the pass-fail step one, because there's sort of somebody who's asking a question about that. I don't think anybody's going to be able to answer what that really means. Like I said before, I don't, we're going to get applicants that have taken step 1 2 years ago, and they're going to have numbers. I'm not going to have applicants that took it, the end of January, beginning of February. I'm just going to get a pass-fail. I don't know how I'm going to compare those factors. I've never used the supplemental part of ARIS before. I mean, I signed up for it, so I'll see what it's like, but I don't know that I can say what it's important or not. It seems like it's something that would be nice to have in addition. But again, I think it's their first year, so I think it's hard for most of us to say what it's really going to do.
Perfect. Would a program consider an IMG resident if they have never had one program in their programs before? What do you think about applying to a program where there's no IMGs?
I would say that's a very, unless you really had your heart set on it, I wouldn't, I wouldn't bank on it. If they don't accept, you have to look whether they accept visas, number one, because if they won't accept visas, then, I see somebody asked about green cards. So green cards, yes, are a benefit because they don't have to do visas. So a green card is potentially something that is beneficial. If a resident or if a hospital or the residencies do not accept visas for residency, there's no point in applying unless I was sort of joke around and say, unless you're coming from someplace else with a huge grant and a lab, unfortunately, they're probably not going to even consider you. A lot of residencies, though, that will not take IMGs for visas will take you for fellowship. So, once you finish your residency, there are places that would not look at applicants who have visas, but will look at them for fellowships. But if they don't accept IMGs, I think again your chances are pretty low that they're going to take you.
I'll kind of echo that. Historically, my fellowship program had not taken on IMGs, but after residency, they learned the whole visa thing just to be able to accommodate myself and a few others. The other thing is, if you are the type of candidate who may have had experience in the institution, and you do have acquaintances or people that you know of within the institution, have recommendations, personal connections, networks. I know that there are a few international medical graduate networks that have networked with physicians in institutions that may not be close to providing visas, or at least wouldn't be close to IMGs with green cards or citizenships. Then I would say if you do have an in, then you would have a better chance of applying. But I kind of agree with Dr. Prata. If you're looking at the websites and the information, you're not only not seeing IMGs, but they're not talking about what visas they accommodate. You can also look at historically where their residents have come from, not just for the past year, but the years before, and where their residents go. That also might help.
Perfect. Thank you so much for your advices. We have another question. Does year of graduation play a role if they have done a home country resident, or what is your view on applicants who have done an intern year in pediatrics in their home country before applying to PEDS residency in the US?
I can share our view on it. Generally, we do account for when we interview applicants that have residency experience. It's not so much that the applicant has done residency as opposed to how it seems that it's affected their own practice, their own training. We do account for it. It's helpful to have it. It's not essential. We've had applicants who have not had residency training before, and their applications had been what we would deem as stronger fit for our program. I would also I don't think that we talked about this either. Many different programs have many different types of approaches, the type of resident that would thrive in that program. We also not just look at the residents that we think are best for a program, but the type of resident that would be happy in our program. And so there are residents who would probably we've had some applicants that have had, a lot of big tertiary hospital experience. Their residencies have been in big tertiary hospitals. And when we interview and we talk about how the experiences in our institution is more community-based, and see that maybe that's not a great match, and that would be a factor into how we would probably put that resident in terms of our impressions.
Yeah, so doing a residency, actually from my point of view or our program point of view, sometimes if you have already done pediatric residency in your home country, that just makes you think that this person is going to be in, is going to do pediatrics, just confirms it rather than, they may be looking at the different programs, different specialties. So it not necessarily you have to. I can give you again example of my institution that most of our international medical graduate had some experience in the past in their home country, and most of them done a phenomenal job because they had, at least their clinical knowledge is good, pretty good. Now, once you come to a different country, now you have, you have to deal with your communication skills, other part of, and the culture and all those things. So you are at least, you don't have difficulty with clinical aspects, so that makes you, I don't know, better, but at least you're not dealing with every aspects of coming to this country. So this is what is our experience have been. So.
Perfect. We also have a follow-up question regarding the applying to programs that have not previously had IMG residents. How does this apply to US IMG applicants?
I think it was
I think that all depends on, again, the visa situation. Again, if a program or a hospital will not support visas, if you don't have a visa, even if you're an American grad who does not have citizenship or green card, it becomes difficult because it's not something they will typically do. I think the way Dr. Salvador's son said that, if you know somebody there, if you've spent time there, you have an in, you may be able to ask them if they would be willing to. But I think if you have no connection there and they don't really take, they don't support visas, regardless of where you graduated from, it's going to be very difficult.
And visa is nothing to do with the program. Everybody wants to understand is the institution who doesn't support, and if they're not supporting, so you can't blame onto program. It's really the institution is not supporting that kind of visa, and that becomes very difficult, which you have to deal with so many aspects of getting into program, is not just part of it, but how the logistics works is when we apply for somewhere, we just think, this is what I want to do it, but there are so many logistics which runs behind the interviews and all those things. So it's quite often the institution, not necessarily the program.
If the question is leaning towards if you do have a citizenship, or you're a U.S. citizen and not really concerned so much about the visa, but you're interested in applying to a program that doesn't take U.S. IMGs or IMGs in general, it's a little tricky because the programs that generally would take mostly U.S. medical school graduates will lean towards maintaining that. If they find an application that may address why was it that, was there a particular reason, what was it that had led you to go through medical school beyond the borders, that might help. We have some applicants who had gone back to a home country or a native country of their family for med school because they had to move with their families. And so even though they're US citizens, they moved when they were in high school or they moved when they were in college and decided to pursue medicine there and then come back for residency. So those are, some interesting points on the application that you may want to describe on your personal statement. I'm not saying that that's something that non-IMG specific programs are going to look into, but it will definitely help.
Thank you. We have another question regarding the US experience and the letters of recommendation. Do you think all letters of recommendation or US experience from before COVID is accepted, or do you think it's better if we have recent ones, like, I don't know, like probably a year ago, 6 months ago? What's the time frame about that?
So when we look at letters of recommendation, the main thing that we look at is the letter itself. Definitely we look at who's writing the letter, we look at when the letter was written. The important thing is this letter a good letter of recommendation? If the letter of recommendation came very recently from an observership with an attending or faculty member that you worked with for a week, and their letter just was very generic, it is not as strong as a letter that you may get from someone you've worked closely with, even though they're not in the US, and has very specific things to say and very good things to say about you. That would weigh much more. And so that being said, it's always best to have a letter of recommendation that's somewhat updated. And this is where it comes in, where if you do have some form of gaps in education, let's say you had to work elsewhere within the time that you graduated and was able to get clinical experience versus the time that you're applying, it's really helpful to have it relatively updated. So if you're applying for this year, to have a letter of recommendation beyond, we understand that COVID has limited a lot of work. But have you worked with other people on an indirect manner, right? Have you continued to work with them remotely? Have you continued to work with them voluntarily? So they may speak about you from a few years ago when you were a med student or when you were in training, and they would just add to what you had done, and you had continued to be in contact with them. That's helpful as well. But the strength of the LOR is really the letter itself. And then we do take into consideration who it is and then when it was written.
So what I sometimes say is 2 years is one thing. Somebody asked me, how long do you know this person? I'm in general telling that, somebody's, one of my resident who left 2 years back and they are moving to somewhere else, and then they want that person to be, they give my as letter of reference. Most of the people actually ask that, it's the 2 years. It's not necessarily a limit, but I think people do want to, and I'm not want you guys to be honed onto it, but it should be a good letter of reference who knows you very well, but it should not be 5 years old. At least I don't think people will like having a letter of reference which was 5-year-old. That's too long a gap. 2 years is a good. People will still feel that they have a good memory of this person, how they were doing it, so it's not absolute, but at least keep that in your mind. So
Okay, now we have another question regarding the scores. What do you think is a good way to overcome a low, well, now a step 2 score, besides improving, I don't know, our CV, our resume? How are other ways to overcome this low score?
I think low scores sometimes are a very difficult thing to overcome because it is the easiest filter for a lot of us to use. That's sort of a universal way of looking. And although a lot of us do want to do more of a holistic review of the applications, when you get 1,500 applications and only 1 or 2 readers, there has to be one that you could filter. If you are able to get your way in, it certainly is best if you, like we said before, explain what happened. If there was an issue with your taking the test or something, never leave it as an excuse. It should be an excuse and something you learned out of it. What did you come out of this with a positive? What's the positive that you came out of this? You learned that you needed to study a different way. You realized that you would use the wrong materials and you would improve. Always make it, spin it into a positive. If you do other things, then put that in your personal statement. Show us in your personal statement what your accomplishments are. Show us what your dedication is. Show us, how you're going to, again, overcome this in the future. The other issue is that we as residency programs, part of what we need to do to maintain our certification is to have a pass rate on the boards. So although, again, we want to have holistic and we want to take a bunch of people that have varied abilities, if you can't take a test, it's going to, in the end, we're left, once you graduate, we're left with that failure as a statistic on our program. And again, the accreditation comes from, part of the accreditation comes from the pass rates. So it is a little bit difficult, and you do have to sort of work your way into what your dedication is, what you're going to do, and how you've improved yourself. And I think your personal statement, along with other things, again, showing your dedication, are the best way to do that.
There was a question earlier about step 3. This is one of the ways that you could probably overcome that, right? So you have one more opportunity after step 2 to show that, maybe you've used different materials, figure out your own learning styles, overcome the obstacles of taking a test. And so if you do feel that your step 2 is prohibitive, that score, to come in with a much better step 3 score, or at least, to pass the step 3 shows that, because obviously we don't see the scores, but to pass the step 3, but anyway, to pass the step 3 is really key. If you have taken the step 3 and been unsuccessful, it's just kind of a little more difficult. So that is where you have to kind of judge your abilities to be able to do all of this at one time.
And talking about the CV and the resume, are research experience and publications required or just preferred? How this will change if the research experience is from home country, or if it's in the US, it has more weight? What do you think about that?
I mean, I think all of those things are bonuses. If you have done research, particularly if it's research that's related to pediatrics, I think I've seen a lot of CVs where people just load stuff on. You could tell they just jumped onto research projects because there was something going on and they wanted to put their name on it. They had like 3 different, 4 different, 5 different research projects from 5 different areas. If you're going to do research, either, again, if there was something you did in the past and you changed your mind because you decided that you didn't really want to be a an adult nephrologist, but you did a lot of renal research. There's nothing wrong with that. But it's odd sometimes to see somebody's done, adult nephrology, and then they've done like something with OB, and then they've done something with surgery, and they did a little bit of peds. It just becomes very disjointed. And I think any research you've done anywhere, particularly if you had something published, that's fantastic. And that's, again, icing on the cake. You're bringing another skill to the program. And that's always a selling point as well, if you've really done that research. The one thing I'll say about, again, the CVs, and I think I've said this before, and I say this to everybody I advise, your CV is open to all questions. So everything and anything that's on your CV, I can ask you about. If you don't know about it, I think you lied. And I think the whole application is a lie. So when you've done research, you should be able to discuss that research. If you've done renal research, I may have my nephrologist interview you. If they say to you, ask you questions about it, and you can't answer it, I know that you just did it because you wanted to have some research on your CV. And again, it draws your whole application into doubt. So make sure that anything that you do or anything that's on your CV, if you have volunteer work, you never know who's there. You never know who's going to say, well, you know what? I do something similar. Why don't you tell me about the volunteer work you've done? Tell me about, where you've gone. Tell me about what this clinic was like. You never know who's going to be on the other end of your interview. So everything on your CV has to be something you could discuss. There's nothing that you can't answer, be able to ask questions and answer questions about. And that includes the research.
Thank you, Dr. Lewis. We have another question regarding the ECFMG certification. What is the view on IMGs who are in their final year of medical school and who may get the ECFMG certification only after the application and interviewing season?
So we actually asked that question, at least in our program, especially when what we used to be the CS or now the OET. So we actually asked during the interview, we say, have you taken your OETs? Is there a scheduled date? And we do encourage them, when you do get your result, please email us back. So we do still take applicants who have not finished or have not obtained their ECFMG certification, but we do make sure that they are in the process of getting it in time. It's always ideal for you to have already taken the test by the time interview season is in. There have been some applicants where, because of scheduling problems, particularly in the past 2 years, they had gotten rescheduled and they had taken their OETs, let's say in December. But it's very important for you to ping us back. So, email back the program coordinator, not just update your CV on ERIS, but update your program coordinators to let them know that you had passed your OETs, that you had obtained ECFMG certification, because we are unable to match you if you are not.
And most of the program coordinator are going to go back and make sure it is there. So the interview is fine, but nobody's going to put you in a matching list if those certificates are not available. So interview is fine, but obviously keep on updating.
I think anybody that's more than a year out, you really have to have your ECFMG certificate. Unfortunately, once a program has an issue, then they will, immediately go to that for everybody. So if you're more than a year out, then you really must have your ECFMG certificate, and everything should be in order for you to be in the match. If you're graduating that springtime of the match, then I think people give you more leeway, because we hope that you'll be able to get all of your stuff together, because you obviously need your diploma for your ECFMG certificate as well, and that you won't have your diploma until after the match is over. But if you graduated more than a year before the match, then you really have to have everything put together in your certificate.
Thank you so much. We have one more question regarding the mentors. How do we find mentors who help us during this season? What are the resources that you could just give us as an example, maybe?
I believe ECFMG has a mentoring program as well. I'm not sure how that works, if that's what you're asking about, but I do believe that ECFMG does have some mentoring programs as well. I think otherwise it's, if you've done work here in the United States, or if you've worked with somebody in your home country or the country of your medical school that did work in the United States, then you can use them as a mentor. I think otherwise it is just difficult to, find people who may be mentors. But you don't necessarily need a mentor to be able to get into a program either. I think, again, there's a lot online that you could look for. There's certainly a lot of help that you could find online as well. And I think, programs like this are certainly very helpful. And I think it seems like there's a community of people that can help each other too.
If your medical school, university, or school has a alumni association, some of them may have affiliates in the US. I find some of that, so I do have, one of our universities has one, and we do occasionally get an applicant to come through about a year in advance to request for mentorship. I do recommend that if you do want to do mentorship, give it time. It's very difficult for someone to mentor you or provide enough mentorship, let's say on June of the year that you are applying, because all of this stuff that we're talking about, this is stuff that is best kind of prepared for at least a year in advance. So if you have intention of, or if you know any other people who have the intention of applying, it's always best to do, a few months before or half a year before, so that this way you have the opportunity to, kind of zhuzh up your CV and your portfolio.
Perfect. Thank you so much for all the pearls that you are sharing with us tonight. We appreciate the time that you take to help us in this process. I think I have one more question. What to do to stand out for a program with less than 5% IMG?
So say the question again.
What to do to stand out for a program with less than 5% of IMGs? Like probably it is regarding that they have their residents are just 5% of IMGs.
I mean, you have to
Find out what.
find out their criteria and be within those criteria. I mean, if you're not in those criteria or higher, there's nothing you could do that's going to make you stand out. And I think that's true of American grads as well. If you're not within a program's criteria, they're not going to be that interested in you. If you have the criteria, if it's 5% or less IMG, and you have great scores and you have a great MSPE, then go for it. I know that a lot of IMGs apply to a tremendous amount of programs. But if you really, again, if you think there's a chance, then apply to it. If you don't, it's, if there's very little chance, then I would say, try not. I wouldn't advise doing it. But if there's 5% and you meet all the numbers, go for it.
And you can always apply, but you can keep on pushing them to get it. And then obviously quite often it may be just visa issue that they're not getting it. And the 5% is, they have green card or whatever. So really understanding why they don't have IMGs is most important, but not running after them either for any program. If program is interested, they'll come after you. So.
Thank you. Since it's getting close to an hour, we'll wrap up with and to invite all our panelists to add any additional final thoughts as we close. Do you want to share us your last pearl of advice to us?
Dr. Crowder, you're on mute.
Yeah, I just do. I think, again, it's all about wise applying. Look at the programs, look at the numbers, look at their test scores, look at the graduates, look where the house staff come from. if they are, if they accept IMGs, if they accept, people, if they accept, residents with visas, and you think you meet their numbers, then go for it. And, I would say try. Remember also, like we were saying, a couple of reminder emails, maybe one thing, maybe a phone call or two, maybe one thing, but calling all the time is just going to put you on a bad list. It's unfortunate, but you've just got to put yourself out there a little bit, but not too much. It's a very fine line, and I think unfortunately there's not much else that can be done. But the smartest thing to do is to look for the programs that you think you will match up with and apply to those. And I'm going to put the link in the chat for the head of the for the NRMP, by the way.
In this kind of time of virtual interviews, and this is mostly like more an IMG thing as opposed to folks who are just dealing with time zones within the East Coast or the West Coast. Please make sure that you set yourself up to succeed. So for example, you've already got your portfolio done, you've done great work, and you've got that interview. Put your best foot forward, right? We understand if you are 12-hour time zones away and that it's 2 o'clock in the morning where you are, but it has to be, at a time when our staff is able to interview, and we try to accommodate as much as possible. There are some programs that actually do dual time shifts to be able to capture different time zones. But please set yourselves up to succeed. If it means, going to sleep during the day and being awake at night, having like a couple of cups of coffee while you stay up, it really matters to us because all we have is the virtual interview. And so how you present yourself during this time in this little box is what we have. And so, try your very best to make sure that we see you.
Yeah, and be positive. And you have only 20, if you get the interview, you have only 20 minutes or so with a couple of people. So be positive, be interactive, don't have a quiet moment, prepare your positive questions and be ready to answer the questions they're asking you. This is the interaction, and that can be, it's a huge impact how you interviewed for those 20 minutes with 2 people, either it's a resident or faculty or program, coordinator. Everybody's input is very important. So
I think especially for the international graduates who are not English speaking as your first language, answering those questions as completely as possible. If all you say is yes or no, then we don't get a feeling of, again, how well you speak English and, how well you'll fit in with the program. Even if you have an accent, that's not a problem, but we want to know that you can speak to us. We want to know more about you, that the longer, better answers really help us understand who you are.
Because you're going to talk to patients, and it's not that we just are looking to talk among each other. Eventually, you got to talk to patients. So we are looking for not just your communication among your colleagues or faculty, but the most important thing you're going to do residency is to take care of patients. So there are several reasons the communication is so important during the time of interview. So.
Thank you so much, Dr. Mita, Dr. Crowder, Dr. Salvador Sison, once again, for all this valuable information. This was super helpful, and we are very, very thankful for taking the time out of your day to speak to us. I want to pass now to Amy, who's going to share with us some things too.
Yeah, so thank you to all the panelists. This was really an amazing discussion. I think we covered a lot of ground. And so I just want to say that thank you to our FuturePedsRes All-Stars who put this event together, and all of our international medical graduate team members. We have a lot of international applicants on our team doing this work. So I just really want to highlight the work that they're doing. Once again, we hope that everyone was able to get something important out of today's event. I know there were some questions we didn't get to, and I apologize. We've only got so much time, but thank you for providing that those questions. I encourage everybody to keep following with FuturePedsRes, and we know that international medical graduates have a lot of different things that they need to consider. So we will keep trying to get resources and answers to those questions, even if we didn't get to them today. And with that, I will pass it to Chiamaka.
Thank you, Amy, and thank you to all our panelists and our excellent team. This was a very informative session. Like Amy said, we do have a lot of IMGs on our team. I am an IMG, Carol is, and there are many of us who are working hard to also improve the equity and the access to information for everyone applying to the match. And we're grateful to the APPD and pediatrics program directors for supporting this process. So to applicants, thank you for coming. As application season and interviews get into full swing, we want to remind you again that we'll be having our regional webinars featuring residency programs from across the country throughout the remainder of July, August, and September. So you can register by visiting our website at FuturePedsRes.com and clicking on Webinar Series registration here on the homepage. Also, to stay tuned to all things FuturePedsRes and PedsMatch 2023, give us a follow on Twitter, Instagram, and also sign up for the listserv on our website. If you've been following our Twitter, we live tweet through all the events, and then there are some important gems right there. We thank you again for attending tonight. We wish everyone a great remainder of the evening or morning, and we look forward to seeing you all at our upcoming webinars. Good night, everyone, and have a good day.